Welcome to another presentation by My Weight World. Liposuction Part 2. Overview. This presentation is designed to give you a brief overview on the topic of liposuction, Part 2. Introduction. If you have not seen so already, there is a section that precedes this presentation titled Liposuction Part 1. Part 1 covers what is liposuction, parts of the body it can be used on, locations to have liposuction, doctor issues, regulation, when it is not right for you, alternatives to liposuction. Part 2 will cover risk and complications. Risk. Liposuction, like any surgical procedure, has risks. Research them on your own. Discuss them with your doctor. Discuss also your doctor's complication rate. Overall, complication rate of most liposuction procedures is around 1/2 to 5%. When deciding whether to get liposuction, ask yourself, does the cosmetic enhancement of liposuction for your body outweigh the potential risks? If yes, then consider surgery. If no, do not undergo surgery. Complications. Infections. Infections are not common after liposuction, but can happen. Antibiotics before liposuction. Some physicians prescribe them, some do not. It is not clear if antibiotics work. Many infections are mild. Some are serious or life-threatening, such as necrotizing fasciitis, bacteria that eat tissue, or toxic shock syndrome. Blood clot embolism. This is a rare event and can happen with any surgery. This is when a blood clot forms in a vein, usually in a leg vein, and travels to the lung. It can range between mild to severe to lethal. It affects the ability to breathe and take in oxygen. This must be treated in a hospital. Fat embolism. Not a common complication. If fat that is loosened by liposuction enters ruptured or broken blood vessels injured during the procedure, it can travel to the lung. Fat clots that travel to the lung can range between mild to severe to lethal. It affects the ability to breathe and take in oxygen. This also must be treated in a hospital. Damage of internal organs. Not a common complication. Can be seen in liposuction of the abdomen. During liposuction, the physician cannot see where the cannula is, so it is possible to puncture the abdominal wall and go internally. It is rarely possible that you could end up with damage to the internal organs, such as intestines. If this does occur, it must be treated in a hospital. Seroma. Seroma is a collection of serum under the skin, almost like a bulging bag. Serum is a straw-colored liquid that is part of your blood which collects in the seroma. Seromas will usually need to be drained, with a needle, in a doctor's office. Changes in sensation. Some people experience altered sensation in the area of liposuction called paresthesias, pain, or numbness. The duration. Many times they are temporary and resolve within a few weeks or months. Some are permanent. Swelling. Swelling may occur near the area of liposuction. Arms and legs probably more common than other areas. Duration. Can range between days to weeks to months. Rarely permanent. Skin death. This can happen when the skin above the liposuction site may lose its blood supply and die, become necrotic. Skin can change color and fall off. This increases risk of serious infection and may require skin grafts. Burns. Some doctors perform ultrasound-assisted liposuction. The ultrasound probe may become very hot and can burn the tissue. Burns are a very uncommon event. Fluid imbalance. Fluids can shift in your body, especially with large and complicated liposuction procedures. Fat contains a lot of liquid, and sucking it out removes a lot of liquid from the body. Many physicians inject large amounts of fluid into the fat tissue to help with the procedure. Fluid shifts can result in fluid imbalances in your body. They can affect your heart, lungs, and kidneys. Severe and moderate fluid imbalances are usually treated in a hospital. Toxicity from anesthesia. Many doctors use a local anesthetic called lidocaine, which is similar to Novocaine that you may have had during dental work. They mix it with large volumes of liquid and inject it into your fat tissue to help with the procedure. The side effects can be mild, for example, ringing in the ears or restlessness. Severe, for example, toxicity to the heart causing it to stop. Usually treated in a hospital, especially the more severe forms. Overall chance of dying varies from doctor to doctor. 3 to 100 deaths per 100,000 procedures. Higher when liposuction is combined with other procedures, such as breast implants. This compares to 16 deaths per 100,000 car accidents. So dying because of liposuction is a rare event, but could happen. Summary. There are risks with any procedure, including liposuction. Since it is almost always elective, the patient solely needs to make the decision to proceed or not. The overall complication rate should be less than 5%. Chance of dying typically 3 to 100 out of 100,000 procedures. Please see Liposuction Part 3, another presentation by My Weight World. This has been another presentation by My Weight World.